welcome back to Parenting Shrink Wrap. Dr. Melissa Wellner here with my co-host Sam Straub and a very special guest that we are excited to have today, Dr. Milena Smith, who is a psychiatrist with a specialization in women's mental health. I met Dr. Smith probably about 10 years ago at a community-related event for mental health professionals. And she has been a great colleague and friend throughout the years. She helped mentor me into private practice. And her and I kind of end up sharing patients in a way that she sometimes is treating the parent and I'm ending up treating their kid or vice versa. But she has a really, really strong background. She went to medical school at UCSF and completed her residency training at Johns Hopkins Hospital, and she still remains there as a part-time instructor, and has focused her career both academically as well as in her private practice on reproductive psychiatry and treating women with mood and anxiety disorders at times of hormonal change, such as pregnancy, premenstrual, perimenopause, menopause, which those changes produce lots of both physical and emotional symptoms that aren't always known, talked about, but they happen to everyone. So welcome, Milena. We are so excited to have you.
Great to be here. Thank you.
Milena, can you talk to, like, as you think about these stages of life, and I know you specialize in treating women, but like in these stages of life where there are these major hormonal changes, can you talk about some of the patterns that, the mental health patterns that can coincide with these changes in hormones?
Absolutely. And while I do treat primarily women, I do treat some men, and it's often around these, the changes in hormones are not the same, but there also may be times of transition, which is often a time that we'll see an increase in the kinds of symptoms that I treat, because transitions are hard. So I will see people getting comfortable in new roles, with new identities, and figuring out how the new tasks that they have to manage fit with sort of what's going on within their body at that time, whether that's during pregnancy, all of the changes that happen postpartum, or then with the kinds of hormonal changes that happen with the monthly cycling, or then the increasingly irregular monthly cycling that typically happens before menopause.
Yeah, amen. Hear, hear. Same. Me too. All of it. But I said this in a previous episode. You know, I dealt with a pretty severe postpartum depression with my first child, but I didn't know that it was postpartum depression. And yes, I had a mental health degree. I was a counselor at the time, but I became a mom. My husband was sent away for training for something professional for 4 months or 5 months when my son was 2 months old. My kid was colicky, and he didn't sleep. And I just thought that being a new mom was very, 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 very hard, which it is. But I didn't realize like how hard it was. And like how can you, what are the signs? That's my big question. But like, what are the signs, for example, for postpartum depression, or if someone's struggling with postpartum anything, that they should look out for? Because I certainly didn't know what the line was when I was going through it myself.
Yeah, I'm so sorry you went through that, and you're not alone in not having it recognized. People don't recognize it in themselves. They'll often think, I just need to try harder. One of the primary symptoms of depression is self-criticism. So very often people will be feeling, well, I'm just not good at this. And they will think that those negative thoughts are true and won't see them as a symptom. So the same kind of symptoms that we see in depression at any point in somebody's life, either decreased ability to enjoy things or lower mood, can happen in the postpartum period or during pregnancy. But some symptoms that are particularly common during pregnancy and postpartum are that self-criticism about that role. Um, and women and men, because postpartum depression happens in all people, can happen in all people. We're recognizing that increasingly. Often it's self-criticism about, well, I should be feeling excited about the baby that's coming, or
Mhm.
I should want to get up 15 times a night to take care of this infant.
No, no.
Right. So there's a lot of unrealistic expectations that then people end up feeling bad about, rather than saying, oh, hang on, I think that I maybe could feel better in this difficult situation.
I
And
think
I
one of
noticed,
those
One of
Melissa.
postpartum things that can be really stressful is women who are trying to breastfeed, which comes with also hormonal changes. Like, it's like every 2 hours. Like, that is a very hard schedule. And women sometimes are dealing with supply issues. The kid has a tongue tie. They're not latching well. Like, it's a lot.
It's absolutely a lot. And infants wake every 2 to 3 hours to feed, however you're feeding them, for the first 3 to 6 months. When I had my babies, I was very focused on trying to figure out how to get them to sleep longer. If I could time travel myself back, I'd say, whoa, whoa, stop. They're infants. They're going to sleep the way they're sleeping. They're going to wake up frequently. How can you get more support so that you're not the only one dealing with it every 2 to 3 hours? Because we know that kind of chronic fragmented sleep is not good for anybody, right? We wouldn't want an airline pilot flying the plane if he's only been sleeping in 2 hour snatches for a couple of days, let alone 6 months. So um, we that's one of the things I think we can really intervene with, is educating parents about how can we do a better job at supporting through those early months where sleep is going to be fragmented for somebody, but maybe we can spread it around a little bit. Maybe we can use strategies that take the load off any one person.
The taking the load off, I remember I did get treatment for that postpartum depression, and it was an SSRI. And within, I mean, not everybody has this luck, but within 2 or maybe 3 days, I was like, oh, I can feel the difference. Like, I still am tired. This is still hard, but all the varies started to go away. And
Mm-hmm.
I was like, now it's not so hard. It's hard, but it's hard. I can handle it hard, as opposed to all of like the shooting all over myself, which you were describing.
I never promise it to anybody, but it's not infrequent that I see something like you describe, where we're telling people by 2 weeks we should be noticing something. But for people with hormonal changes that are triggering symptoms, often improvement happens within a couple of days. So fortunately, while it's not universal, that's not that uncommon. One of the main ways we think that these medications work is by increasing neuroplasticity. So that allows for more flexible thinking, which may help a person get out of rigid, anxious thinking. I've got to get up with the baby every time. I've got to be the one who does everything, and maybe it then allows a little more support. So,
Wait, that is so fascinating to me. And I've never, I've worked with, I'm not an expert on medication. I work with plenty of clients who take medication for mental health related reasons, but that an antidepressant increases neuroplasticity. I'm so fascinated. Can you dig a little deeper on that? First of all, just
absolutely.
describe what is neuroplasticity for our listeners.
Absolutely. So we back in the dark ages, although the brain stopped developing once we became an adult. Fortunately, we now know that it develops. Not only we know a lot about the risks of we want kids to wait on using drugs as long as they can. Maybe 25 isn't some magic number, but basically the longer you wait, the less effect it's going to have for them in their adult life. But our brains continue to develop and forge new connections our entire life. When somebody becomes depressed or anxious, their thoughts become more rigid. There are patterns in depression. They might be these loops of self-criticism that I know you've both heard people describe. It's like I sometimes talk about it with people as a rut that the cart will just slide down no matter what the topic. A depressed person can always find a way that it's a negative about them. Similarly, when somebody's really anxious, anything can be worried about, right? That if you relieve one source of anxiety, I sometimes think of that as a balloon that you squeeze, maybe like a water balloon. You squeeze it, the anxiety pops out one way. If you release it, you squeeze it again, it will pop out another way, right? So again, you've got that rigidity and inflexibility of thought. You add a little bit of an SSRI or another medication into the soup that bathes our brain, and the brain starts being able to consider other ideas. Um, when people have mild symptoms, sometimes therapy alone is enough. Sometimes talking to another person, sometimes a support group, other ways that we can be introduced to other ideas and say, oh, I hadn't thought of it that way. Maybe I will try sharing shifts at night with some other person, and then the magic of a little more sleep can help with recovery. But sometimes it's that medication that then people are able to be less self-critical, be able to think of things with less rigidity and inflexibility.
I just had, of course, that makes perfect sense, but I didn't know that that was something that medication did. I thought it was like the
Yeah.
relief of something else. Of course that like the chemicals in your brain can not just make you feel different, but really change how you think, and what your brain attends to is
Yeah.
amazing, actually.
Make it capable for us to consider new thoughts and to forge new patterns,
Yeah. Yeah.
which is wonderful
Calming the
because
storm.
in therapy you might expose people to all these wonderful ideas, be more mindful, be more self-compassionate. But if their brain cannot receive those ideas, if they can't incorporate it, then that can be just another thing to beat themselves up for, which I see sometimes, right? Oh, I know I've been getting all this great advice. I should go for a walk. I should meditate, but I sit and meditate and I just beat myself up. That's
Hmm.
another form of torture.
And
So
I want to circle back to, you mentioned men can also experience postpartum depression. And I feel like that is a topic that is definitely not out as kind of general knowledge. I think women get a little bit more of it when they're going to their OBGYN during pregnancy. They're probably getting, or hopefully getting, a lot more education
Mhm.
about their emotional well-being as well, and this impact. But the men sometimes aren't in every single appointment, or all the appointments that the woman is going to while pregnant, and I don't know that they're getting that same information. So I think that's a real area of interest, and really not an explored area for that matter either.
Yeah, no, it's something that's really started to be investigated just over the last 5, 10 years. The data that we have suggests maybe 8 to 10%, up to 8 to 10% of men. One of the reasons people started looking at this is that while we know that the hormonal changes after delivering a baby, you've got all the estrogen and progesterone building up, and then there's a rapid drop after deliveries. It makes sense. But we know that women who adopt a baby can also get postpartum depression. So I think that opened people's eyes up to, oh, other humans who have suddenly a baby in their life might have some increased risk for mood and anxiety disorders as well. And there are
there
more
are
supports available for dads. There's some groups, that support groups and information online, so that's starting to be available.
so necessary, and because I think sometimes we attend to in fact we have an episode about this, about like attending to the needs of the mom, like the one who has just delivered,
Yeah.
or who's up doing the nursing or whatever it is, and we forget that, we don't forget, but maybe society doesn't attend to the fact that there's the disruption exists for all of the caregivers.
Yes. I've definitely had people who come in and we are focusing on their postpartum anxiety and depression, and they get better. And then they say, hey, we've realized he's really struggling too. And it can sometimes look like avoidance, which can lead to a lot of conflict in a couple.
Yes.
And one of the ways postpartum anxiety can show up is not wanting to hold the baby, not wanting to be alone with the baby. If you've got a dad who's anxious and then being asked to, well, show up more, do more, and it's really triggering their anxiety, that's going to be a really rough for both people. So both people have to be healthy for either of them really to flourish.
So this may be a silly question, but I am in perimenopause right now, which is the other time of my adult life where I've felt like wacky hormones. And one of my mental health symptoms that come along with this is random days of where I feel randomly anxious. Just I wake
Yeah.
up and I am like, I know what this is. There's nothing to be anxious about, but something tells me I need to be battening down the hatches because there's dread in the air. Like that's how I feel.
Yeah.
Um, and I've done enough reading and learning to know that this is a symptom of perimenopause. I don't like it. I'd like to return it. Like I don't want to own this.
Return to sender, Sam.
Return to sender. But here's my question. First of all, I'd love to hear you talk about your work with perimenopausal women. But the question I have, building on what we were talking about caregivers, is during perimenopause, do partners go through something too? Like I'm married to a man, and I've never asked this question or thought about it. And like I'm weird, I'm different. There's things that I'm doing. Can we expect? Are there other studies out there? Do men go through things when they're perimenopausal women start acting like me?
That's a fascinating question. I don't know of data. So it seems like there's sort of two questions. Men's hormones are changed by their surroundings. Definitely, we know that the birth of a child, a man will actually have generally a lowering in their testosterone level. I don't know of any studies that look at what happens if they have a partner going through perimenopause. Certainly, lots of couples have struggles around that time. It is often a time where their kids may be launching. There's so many transitions going on at that time that I think that's a fascinating and excellent question that I don't know the answer to.
Fair. Didn't mean to put you on the spot, and I don't know the answer either. And I've never read anything about it. The question occurred as you were, and I never heard about postpartum depression for men. So that was what generated the.
Well,
the
men
thoughts.
though do also experience their own hormonal changes through the years as well. So it's not
Absolutely.
like they're also not experiencing any changes in their testosterone levels as well as they get older.
There's not my understanding is it's more of a gradual decline, whereas when going from reproductive phase, which is from puberty to menopause, you go through that transition to perimenopause from sort of regular monthly cycles. If you're a woman who has regular cycles, which isn't the case for everybody, you go to some pretty exciting fluctuations day to day, week to week.
I wouldn't
One
use
of the
the
reasons
word exciting, Dr. That's not that might be a little euphemistic, but continue.
One of the reasons that blood tests aren't used to evaluate perimenopause is because the blood levels of varying hormones will change multiple times a day. So any individual snapshot is pretty meaningless. So that's why we go with clinical. Clinically, is the menstrual cycle becoming heavier, lighter, changing in its length, etc. And women who have had symptoms either premenstrually or during pregnancy and postpartum are at higher risk during perimenopause of symptoms. So I'll not infrequently see somebody who I treated during pregnancy, postpartum, they did well for a number of years, and then their cycle starts to get uneven, and we're going back to a little bit of the same, fortunately very treatable again.
what are some of the ways that you do? We've talked a little bit about treatment for hormonal changes around childbirth. What are some of the ways that you treat people who are dealing with the end of their reproductive life? You know, like perimenopause and menopause. How do you work with those clients?
So I always use behavioral strategies, so long as a person is well enough to use them. So regular exercise, healthy diet with fresh fruits and vegetables as possible, less processed foods, time doing something that's enjoyable, all of that healthy living stuff. Doesn't have to be a meditation practice, but some kind of activity where you're feeling like you're in the moment and able to be present is very helpful. And then medications, and interestingly, the same medications that work for the vasomotor symptoms, the hot flashes and night sweats of perimenopause, are also the ones that are helpful for mood and anxiety. So the SSRIs, it's all off
Tell me
Lexapro.
more. Sorry.
All hot flashes and night sweats. So do the SNRIs. So does Remeron. So interestingly, those medicines can often be used at the same for the sort of treating multiple symptoms at the same time. Sometimes having a continuously dosed birth control to smooth out those hormonal shifts until a woman is no longer needing contraception, at which point menopause hormone therapy can be really helpful again to just smooth out the hormonal shifts, and that often leads to improvement in mood as well as other symptoms. So fortunately, we have lots of ways to intervene.
Milena, is there any connection between women who have struggled, postpartum? Do you see a link there with them also struggling again, like come perimenopause or menopause?
Absolutely. And we, data to back that up, that if you have had increased anxiety or mood symptoms at another time of hormonal change, you're at higher risk than average with the next set of hormonal changes.
Do you think
again?
I'm sorry, I interrupted. Can you say what you just said again, Dr. Smith?
Often the same treatments work again. So if somebody had a great response to Zoloft when they were postpartum, very good chance it's going to work really well again.
Do any women make it through perimenopause unscathed? Do any of us get to the other end feeling?
How do
is
you
there hope?
Unscathed?
I want to put a big spotlight on this. Like this is, I recognize this topic is getting a lot of attention now, but it didn't 20 years ago. Like you can type in perimenopause and all sorts of podcasts everywhere, and like you're gonna find stuff on it. Like you can.
It's talked about a lot.
Yes.
Yes.
But so
my medical training, zero.
Yeah, absolutely. That's what I mean. Right. Yeah. We've had to learn on the fly. So, but are there women on this planet? I'm not one of them, but are there women on this planet who go through perimenopause and like just go on about their merry way? They're like, oh, suddenly I don't have my period anymore. That took 2 unpainful years, right? Like does that happen?
It does happen. What I want to let you and your listeners know, though, is if you're not one of those women, it does not have to be years and years of suffering. That we do have a lot of options that can be really helpful.
And if is going to a psychiatrist the right option? Is going to your OBGYN the right option? Like what's the first stop shop for someone who's dealing with some of this?
Well, given that until recently there was basically no part of this covered in medical school curriculum, we're all learning and catching up, and there are excellent primary care doctors who are getting to be very savvy about this. OBGYNs are more and more great resources for this. And then any psychiatrist who specializes in reproductive psychiatry is going to know about this, but more and more general psychiatrists are as well. Anything that becomes popular in medicine can also attract some unhelpful information.
Mm.
So I would want people to know that there is no data that there are any particular supplements that are helpful. Now, if a woman has a specific vitamin deficiency, vitamin B12, vitamin D, things that can be screened for, but there's no need to go spend money on any kind of proprietary supplements that you don't need to be spending money on expensive blood tests. There are blood tests that, if in particular cases, are helpful and to rule out other medical conditions. But you can use your insurance. You can go through standard medical care and get excellent care. There is really good information available on the web through the website menopause.org, which is the North American Menopause Society. They offer conferences each year. More and more clinicians are going to them and getting sort of updated on what is standard of care, what do we know, how to treat effectively and safely.
And I think one of the most common things I've heard of at women and girls of all ages is everybody wants like the blood test to look at their hormone levels. And I think your point earlier that it's a snapshot of what's going on in that moment when your blood draw happens, but it could be totally different an hour later is really important for people to know. We can't just look at hormone levels and determine everything and the best course of treatment. They can indicate like that you're in where you're at in regards of a bigger, much bigger picture, but it's such a snapshot in time, that blood test, that it's not going to necessarily dictate some massive hormonal issue that you have going on or don't have going on.
There are instances where we definitely want blood tests if somebody is going through treatment for infertility. We want to know, are they in early menopause? If they're having symptoms of menopause before age 45, we want to know, we may be looking at other blood tests. Do they have a thyroid issue? Is there something else going on? But perimenopause itself at standard ages, that's followed clinically, and treatment is too.
You mentioned, that reproductive psychiatrists would be a good place to start. Is that a specialty? Like, if someone Googles reproductive psychiatrists near me, like, how do
Yes.
in Annapolis, Maryland, you can find Dr. Milena Smith. But what if you have listeners all over the globe? Actually, like, we've got people not just local. How do they find a you?
So there are now fellowship programs. So people do a psychiatry residency and then they go do a couple of years. There are more and more of them around America, around the world. Really phenomenal reproductive psychiatry in a lot of different countries. And some of them work very closely with pediatrics. Europe, Australia, all over. So you can be looking there. Ways to find local people. The Postpartum Support International keeps a great website where you can search by location and put in your state, your country, and people will come up who have either had fellowship training or have training through Postpartum Support International. There's the Marseille Organization of North America offers certificate programs, and so there are more and more ways that people can get additional training, and that website is a great place to look.
Awesome. And will you share that with Melissa and I so that we can put that in the show notes for our listeners?
Absolutely. So Postpartum Support, then the Mass General program has a wonderful website with up-to-date information, and I'll share that with you. I like to do show and tell, so I've got 2 things for show and tell. This book is excellent.
Okay, so for those of you who aren't watching, who are listening, it's called What No One Tells You, A Guide to Your Emotions from Pregnancy to Motherhood, and I can't see the author. Who's the author?
It's Sachs and Birndorf.
Sachs and Birndorf. Oh my gosh, I want that book.
It's very good. It's very user-friendly. It is not It doesn't have a lot of unnecessary detail, but it really goes through what to watch for. When is it an emergency? When is it maybe normal? And you can try some strategies at home. When do you really want to make that call, either to your primary care doctor or to 911 or 988?
All right, we're gonna link that in the show notes too, for sure.
And then this author, Karen Kleiman, has a lot of great books, but this is one I keep in my office and hand to people all the time. It's called Good Moms Have Scary Thoughts. It is a graphic novel. And
graphic novel for mothers about like hating motherhood sometimes.
About the fact that over 90% of new moms will have negative thoughts about either their baby, their capacity to care for their baby.
Yes.
Absolutely normalizes it. Again, when is it something to really be scared by? When is it something that calls for more self-care?
Oh, that's awesome. Good Moms Have Scary Thoughts. That, first of all, that title's phenomenal.
That is a great title. I love the title. And I like that it's a graphic novel, because if you're in that postpartum period, like you probably don't have the bandwidth to be like reading a chapter book. Like
you could be nursing your kid and reading Good Moms Have Scary Thoughts.
Pictures. I love it.
Yeah. So the one last thing I would want to make a plug for your listeners, if I might, is that planning during pregnancy or even preconception can be incredibly helpful with managing symptoms postpartum. So once you've got that sleep deprivation going on, once your concentration is shot, it's going to be harder to get in place those supports, to reach out for help. And those thoughts are often going to be more rigid and stuck. So having those conversations with the OB before pregnancy even, or during, or with a therapist, or going to a support group and looking at what am I going to need, normalizing, seeking help, and getting support rather than mom has to do it all, or just the couple has to do it all.
Thank you. Thank you for your expertise, your good humor, and also for all of these amazing resources, including your background and all of the things that you shared with us today. Thank you also for listening here on Parenting Shrink Wrapped. We are so excited and pleased to be able to have guests like Dr. Smith on. And we would also love to hear from you. If you've got a topic you want us to cover, a guest you'd like us to invite, please reach out. You can find us at parentingshrinkwrapped@gmail.com. And if you've got a parenting dilemma you want us to wrestle with on air, send that to us also. You can do it. You can let us know that you want to make it anonymous. But we would love to, talk through what you've got going on so other listeners can benefit as well. Thank you again for tuning in to this episode of Parenting Shrink Wrapped. We love you. We love your kids. Thank you for raising the next generation of world changers, and we will see you on the next episode. Thanks for joining us on this wild ride called parenthood here at Parenting Shrink Wrapped. We hope today's episode gave you some useful tools and maybe even a few laughs to help you navigate the twists and turns of raising teens and kids.
Remember, parenting is a journey, not a destination. And no matter where you are on the road, we're here to help you stay on course. Whether it's monumental meltdowns, teenage turmoil, or just the everyday chaos, you don't have to travel this path alone.
So until next time, keep your seatbelt fastened, your sense of humor intact, and your eyes on the road. We'll be back soon with more compassionate conversations and practical strategies to support you and your family.
Don't forget to subscribe to Parenting Shrink Wrapped wherever you get your podcasts so you never miss an episode. And if you've enjoyed today's show, we'd love it if you'd leave us a review and share it with a friend.
If you have suggestions for topics you'd like to see us cover in the future, feel free to send us an email at parentingshrinkwrapped@gmail.com.
Until we meet again, take care and enjoy the ride.